Hi, I'm Dr. Margreet Wibbeling, midwife specialist and your host of the Birth and Baby show, brought to you by Sister Lillian Center and Sensitive Midwifery. We empower moms and midwives to have the best birthing and parenting experience through natural, physiological and intuitive care, resulting in birth and baby advice you can trust. Hi, and thank you so much for tuning in. In today's episode, we'll be talking about your birth options and more specifically, what are my options? This is the first episode from a lovely series that we are busy developing. Where we'll be talking about all sorts of birth stories and birth options. I'm sure you will be loving this one. This episode is going to be the first one of a series called Birth Options. And I'm very excited about this series because many expectant couples have questions about what options do they have when they are pregnant, when it comes to birth. Now, what we're first going to do is just a little bit of information in this session. I will explain to you the different kind of births and then the options depending on the settings and where you live. And then in the following episodes, we will be interviewing moms who actually have had the different options. So we have all the different experiences in real life stories. So that's going to be very exciting. So when you're pregnant, expectant couples, obviously first thing that you think of is like, how am I going to birth this baby? And that is something that really you come to mind. Maybe you've thought it all through and you're very much aware of how you want to see this all unfold. But for many, that's not the case. And it can be quite a daunting journey. It's like, where do you start and how do you navigate it through? So when we talk about different birth options, there's mainly three main ones that we can think of. And that's what we like to divide them in. You probably have thought three. I know only from two, perhaps. That's one per vagina and one with the cut, right? But we like to, here at Sister Lillian Center, like to divide it a little bit more. So there's a normal birth or the normal vertex delivery, NVD, that's how they call it in the medical world. So that can be a birth in a hospital unit or a midwife-led unit. Normally, it can include quite a bit of interventions. But whatever has happened, it has come through the vagina. So that's a normal birth, a vaginal birth. Then obviously there's a Caesarean section, which is a abdominal surgery. And then we can have the two sides of a Caesarean section. Either it's an elective Caesarean section, where that means it's been planned ahead of time, it's scheduled, you don't go in labor at all. And then you can have the emergency Caesarean section. That is when you've, as it says, have come into an emergency. So it's a life-saving procedure, either for mom or for baby. You've been in labor for X amount of time, and for some reason, it's not going to happen per vagina, so we are going to operate you. But then there's another option, and that is what we call the natural birth. And that is really the way that Mother Nature has intended it to be. If all goes well, it's a very peaceful environment. It's without any medical interventions, only natural interventions. And that is definitely also an option that you can consider. This episode is sponsored by Zinplex, one of the market leaders for more than 2 decades. Zinplex provides quality and affordable products, and it's trusted by moms and midwives alike. Visit zinplex.co.za and get your hands on these products. Zinplex, a healthier way of life. All right, so let's go through all these different options one by one. I would first say, let's talk about the normal vertex delivery. That is sort of the one that is most common for everyone. And that is where you go to a hospital or a birth unit, and there you are. Now you need to get this baby out. It often includes a midwife on call that can coach you right through that period of time when you are there. And oftentimes it's during her shift. And then together with doctors in the background, back up for in case there is a need for an intervention. So the approach is that every woman can give birth per vagina, and we're going to give that a good go. And whatever it takes. So sometimes that means interventions, it's pethidine or epidural for pain medications. You oftentimes really in a confined environment, a one-room space. The birthing room can even look a little bit like a theater, so it's quite clinical, it's quite medical. There's a lot of equipment around you. Normally those births happen on the back in hospitals where you have less freedom of movement, and then everything that comes with that. So these births can be quite medicalized with a high rate of interventions. But however, it is a normal birth. Then you can have a variation on this, and that is obviously something like a home birth. Now, home birth is where you would have a proper natural birth. The rules for a home birth is that you need to be 100% healthy. You're a low risk category. We've screened for any kind of risk factors that would exclude you for the option to be at home. So there are some good criteria in order for you to come in this category of option. Then you work with a private midwife that is dedicated to your process. Normally she's the only midwife that you will see. So it's very much a caseload, one-on-one, very private experience. The beauty of that is that you really build a trust relationship with your midwife. And that is what facilitates a beautiful natural birth so well, is that you can completely feel relaxed. You know the people that are going to be around you, and you know your environment, which is so wonderful from a home birth, because it is in your home. So that is also really, really comforting for many women. Some women don't think that's comforting at all. They really want to be in a hospital with all the stuff around them, and that makes them feel calm and safe. And other women get completely fearful when they think of hospitals and doctors and medical stuff around them. So they definitely want to opt for a home birth. So there's no right or wrong in this. If it is an option for you, if you have access to a midwife and this is something that you fancy, then I personally love home births. They are my absolute favorite. I see how well it can work if a woman is completely relaxed. And for birth, that is really the bottom line. For birth to work well, you and your partner need to be very calm and relaxed and not be anxious, because anxiety works against the birth hormones. It brings up cortisol and adrenaline, which inhibits the oxytocin, which is the love hormone, which you really need for birth to work well. Oxytocin is the hormone that brings contractions. So let me just throw some physiology in there. All right, so a home birth is safe if you have a backup in place, if you're not too far from a hospital, in case you do need intervention, because then you have to move. So that could be if the baby is going into some sort of fetal distress or not progressing fast enough, or if the mom is getting exhausted. Those can be reasons to transfer to a hospital. And those can really be well managed. I have to tell you, oftentimes couples are wondering about the safety of a home birth, but it needs to be done with an experienced midwife that really knows also how to deal with complications. So if things happen at home, it's the same as being in a hospital. You deal with it. And also bear in mind that you always have time. There's time to start seeing when something is maybe not going as smooth anymore. So we have time to transfer. Obviously, it's never a nice thing to have to do. But you have to, in your preparation, be aware that might be the case, especially if you are a first-time pregnant mom. Then there's a slightly higher percentage of women that needs to be transferred into a hospital for some medical help. But 80 to 85% of people can completely do this, all natural, all in the comfort of their home. Just imagine that. All right. Unfortunately, the problem is that there's not too much access to these options, because there's not enough midwives and not enough midwives close to hospitals. So if you are living far away from a referral hospital, then we would rather suggest that you facilitate a home-like environment close to a hospital. So that takes me to the next option, and that could be like something like a active birth unit. There's not too many in our country yet, but I'm convinced that it's coming. We're working on it, that we have midwife-led units close to a hospital or next to a hospital. And we make it also midwife-led, and we create a home birth environment to facilitate all the good things, the positive things that comes with a homely environment, a relaxed atmosphere, peaceful, quiet, tranquil, and to just help you to birth without anxiety and fear. Now, an active birth unit really advocates that you are actively involved in your birth. It's a mind shift that you might need to make, that you think like, I'm going to a hospital and a doctor is going to deliver my baby, or the midwife is going to deliver my baby. You need to remember that you are actively involved in this process. It's your body, it's your pregnancy that has happened all natural up till that point. And then the birth is something that you are going to be doing and that you're actively involved in. And that can mean just basically listening to your body and moving around the way you feel your body needs. So different birthing positions. Sometimes it might need you're going to be on all fours, or you feel like you need to get in a bath for some relaxation there. So it is very much a place where we empower a woman to be at the center of her birth together with her partner. And then we coach a woman through that process, that she can birth her baby in the best way. Now, an active birth unit can really facilitate that too if you don't have the access to a home birth environment. And you might even find that this is possible in a hospital setting too. If it's a hospital that is very much have got very dedicated midwives that understand the natural approach, then you can make your little home in a hospital setting. That's what I always encourage my couples to do. If they don't have more options than really going to that one hospital, is to make that little room as homely and as peaceful and as comfortable as you can, and still have an active birth where you actively involve in your birth, move around, use different positions, and so forth. And then you also have the water birth. I'm sure you've been wondering about a water birth. Everyone, I think, wants actually a water birth. If you're pregnant for the first time, it just looks so serene, isn't it? If you've seen some pictures of it, it just looks lovely. Maybe you're not a water person at all and that's not your thing, but I've noticed that many people like the thought of it. So what is the deal with a water birth? Well, obviously water, what does water do? If you love water, if you love bathing, you love it because it makes you really relaxed. And that is what we need for birth, right? We want you to be as relaxed as possible. And water is a really, really great aid for that. So whether the baby gets birthed in the water or you just use water for your labor time to get through that time of contractions, that doesn't matter. But to have water available during your birth has got so many benefits. I've seen it, how it works, how it relaxes mummies, how it just helps them sometimes through some nasty hours where they just have to have patience and these contractions are full on. It really, really soothes and relaxes. Sometimes I've had women go out of the water because you know when you've been in the water too long, you get all watery skin and you just want to get out. And then for the last phase to get the baby out of the water, that doesn't matter. It doesn't mean that the water birth wasn't a successful water birth if the baby wasn't birthed in the water, but just to make use of it. So, but when you actually give birth in water, that means that the birth is exactly the same as out of the water, but the baby gets birthed through the water. So that's all it takes. It's just from through the water onto the mummy's chest. The biggest question here is from everyone is like, but what if the baby's going to inhale water? Because it's that first breath. Don't worry about that. The baby goes from water to water environment, and the lungs only open up when there's a change of air pressure. So lungs work on pressure. So as soon as the baby comes out of the water, that is when the pressure will change and when the lungs will open and when the baby will take its first breath. So under the water, baby won't breathe, and remember, it's still connected to the cord, to the placenta. There's time. Baby still gets all the oxygen it needs through how it has received oxygen right through pregnancy. So there's time. It's a very gentle transition for the baby. Mothers claim, and I've seen it also, that these babies are very calm. So transition from water to water is a very calm, gentle approach. I just want to put on a side note that a water birth is also just for certain categories. So there might be high-risk scenarios when it's not possible. And also it should be done by an experienced birth worker that has educated herself or himself on water birth. Hygiene is important, clean water and bath and those kind of things. So make sure that your caregiver knows the deal. It can be done at home in a bathtub that you rent, or even if you have a proper bath with enough space and enough depth at home, that really, really works well. In hospitals, if they're open for it, you can also rent a bath and put it in the hospital room. But at the moment in South Africa, there's not too much of that happening because hospitals hasn't got the facilities for it. And so that it's more a possibility in a home birth scenario or a midwife-led unit. Right, so we've had the natural birth, the normal birth in a hospital, then a natural home birth, a natural water birth, and an active birth, and possibly a birth unit. So what's next? I think let's talk about the Caesarean section. All right. So the Caesarean section is a birth, and it is also, no matter what birth you choose, well done. It's amazing, and it's not an easy thing. And a Caesarean section is also not an easy birth. Even though you might think like, oh, that's easy, I can plan my dates, I'm going to get the baby out on the scheduled time. It is a big abdominal surgery. You're going to need a lot of recovery time after that. And it is also a big deal and a wonderful achievement. So in many, many countries, a Caesarean section is only in case of an emergency. So by default setting, when you are pregnant, all women will go into natural labor for many, many good reasons. It's not just because that's what we do. Natural birth is the best for mom and baby if everything is healthy and normal. There's a reason why we designed that way. Else we would have had a zippy on our stomach. Okay, so natural birth, that's a whole podcast on its own, on the benefits of it. So it is the best way. Obviously, Caesarean sections can really save lives. I mean, if a baby is stuck, if a baby gets in distress, if the outlet, there's a wrong positioning happening and we can't see how we can get that right with different positioning and active birthing, then a Caesarean section is sometimes needed. And we super, super need it and have to have referral in place that we can have a Caesarean section at all times. An emergency Caesarean section can be quite stressful because obviously now you've been through labor for quite a while, you're probably exhausted. And when the call is made for a Caesarean section, it's normally an emergency situation. So it's not going to be, things are going to happen fast. So often as soon as this decision is made, Caesarean section, you could be in theater and the baby can be out in the next half an hour. And that means drips need to be put up. You need to be prepped for theater. You're going there, you're going to get anesthetics done, either through epidural or general anesthetics. You get all draped in the green sterile fields, and now there's a lot of people and a lot of happenings around you. It's a cold theater, especially if you've come from, for example, a home birth environment where everything was so peaceful and wonderful, then this can be quite a mind shift to get into that. But be assured that at that time you will do anything to get baby out. So most of the time you will be totally fine with that. As long as you know in the process why decisions have been made and that baby is fine, then you will be totally fine with the outcome. But just bear in mind, emergency Caesarean section can be a bit stressful. Then an elective Caesarean section is, as I explained, when you have decided before the time that you want to have a cesarean section no matter what. You're not going to go into birth, into labor. And some women really have their mind set on that. And in certain countries, that is actually a choice. So in South Africa, in a private sector, that is an option. You can definitely decide to have a scheduled cesarean section. And the nice thing from that is that you can come in on your set date that you've chosen for the birth. It's a way more controlled environment. And specifically for your typical A-type woman that has her life very much together and used to plan everything, she would like to opt to this. So those are definitely benefits from it, but we also need to keep bearing in mind that a natural birth is best for mom and baby. I'm not going to unpack it right here now, but an elective cesarean section, there are just a few things that you need to bear in mind if you want to go this way, is that you induce a bit of a prematurity on the baby because the baby hasn't told you that it's ready to come out. So with a natural birth, it's the baby telling the body, mom's body, she needs to get contractions. It's actually oxytocin from the baby and it's lung maturity that happens. So it's an induced prematurity that we put on our babies, and some developmental milestones have not been achieved, and there's a higher incidence of babies needing to be admitted in an ICU afterwards because of wet lungs. The breastfeeding doesn't happen as easy and as naturally, and as well you need to be in bed flat for 24 hours, recovering from a massive abdominal surgery. It's way more difficult to handle the baby. And you don't have your natural hormones that will support you afterwards. After natural birth, you're on absolute high from all the hormones and adrenaline. So yeah, just bear those things in mind when you are considering your birth options. Okay, so I hope that was helpful, that you understand a little bit the different options that you have. And it's definitely something that you need to look into and prepare yourself. Okay, so don't be that person that just go to the doctor and let him tell you exactly what to do. I love our doctors, our obstetricians, but they are medically trained and they would love to schedule you for a Caesar in our beautiful South Africa. And I also love our independent midwives, and they will just talk you into a natural birth no matter what. So we just need to be wise in all of this. So it depends on your condition. It depends on how your pregnancy has gone. If you are healthy and falling in a low risk category, then you've got your options for natural birth. If you have more high risk indications, which could be blood pressure or heart disease or diabetes, then things can look different and we do need some medical intervention. So that is number one in your consideration. Then I would really highly recommend to give the normal birth the first chance. Even if it's in a high-risk controlled environment, natural, normal start of labor has got so many benefits for baby, and I'm also an advocate for the baby here. Okay, so definitely do your research on that. Don't just take any advice from anyone out there, especially if you've grown up in a high intervention, medicalized approach to birth. People will obviously put their experiences and fear on you. So be wise in who you listen to, and don't just let anyone tell you what to do. Do your research and run it through your own heart, what you think is best, that will work with you together with your partner, obviously. But birth can definitely be super empowering. I think there's been this lie out there that birth is super scary and that it's fearful. It's fear-loaded environment. High litigation is happening in and around it. Stop suing, please, that you can get those insurances down. And that has robbed so many women from a good birth experience. So it's time for us to reclaim birth and to believe in it. And there are many people out there that want to empower you. There are amazing childbirth educators. There are amazing doulas. There's things like hypnobirthing, which just really helps you to focus on birth empowerment and breathing. So go get informed and empowered. and make your birth your own. It's your body and you're in charge there. So you can definitely have a beautiful, beautiful birth experience. Last thing I want to say, as much as if you planned your birth, things always can happen. And that is something you also need to bear in mind. So yes, we can have a start of, I'm going to have my water birth, my home birth, my active birth unit, or even my elective Caesarean section. And then things can just still happen. So an elective Caesarean section, you might just go into labor before that date. And for a natural home birth, you might be that woman that needs to be transferred to hospital. So always be aware that there can be some interventions needed. As long as you've got all your things in place, then there's nothing to worry about. So then you can play safe in safe boundaries, right? And midwives really know what are their safe boundaries that they can play in, which stays in a normal, natural environment and when intervention is needed. Obviously, there's also something like availability in regards to where you live, access to care, and then in South Africa, we've got a difference between a private sector and a government sector, where government sector is for free and private sector is where you pay either yourself or through medical aid. So those also will limit or expand your options. In the government sector, the approach is normal birth, natural birth first, and then from there, interventions only when needed. Oftentimes, the midwives are very skilled because they do this all the time. However, it's less active birth. We're working on the midwives there that I understand a natural approach. We're really doing a lot of education there. But unfortunately, it's still quite a lot. Giving birth on the back, putting up drips, giving pethidine. So if you only have access to a government hospital, just be empowered and talk to the midwife that's going to be that's in your shift, in her shift when you are there, and tell her your wishes and work with her. It's for every midwife. It really is wonderful if you have an empowered mom that knows how to do this and take control. All right. So I think I've said more than enough in this episode. I can talk forever about births and birth stories. And we're going to be doing that as we are interviewing our moms. So be on the lookout for that series. It's going to be wonderful. That was me for now. Bye. Thank you so much for joining us today. If you enjoyed this video, please share this with a friend who will benefit from this. And remember to subscribe and hit the bell icon so that you can be notified whenever we release new videos like this on our channel. We'd love to stay in touch and keep you updated with all our latest content and resources to equip and empower you. So if you're a midwife or any type of birth and baby worker, go to sensitivemidwifery.co.za/free gift. If you're a mom, visit sisterlillian.co.za/free gift for more training and resources. That way we can keep you up to date when we release new episodes like this, plus a few other bonuses. You can also find the links I just mentioned in the show notes. Remember, you're making a big difference because you are shaping the future of humankind. Thanks for watching, and I look forward to journeying with you. Pregnancy is a time of great change and excitement, but it can also be a time of uncertainty. The Sister Lillian Center Essential Antenatal course will help you journey through your pregnancy better by arming you with the information you need to make informed choices about your health and well-being so you can have a healthy pregnancy experience and make the right choices for your birth. Click the link in the show notes or visit sisterlillian.co.za/pregnancy to find out more about this invaluable course. And hey, if you're enjoying the content, remember to share this with a fellow mommy or friend.